Before the mid-1800s, surgery was a terrifying ordeal. Patients were fully conscious, often tied down, biting leather straps or given alcohol to dull the pain. Surgeons were valued for speed over precision. Robert Liston, a famous British surgeon, could amputate a leg in under a minute, though sometimes with disastrous results. Mortality was high not just from the surgery, but from shock, blood loss, and trauma caused by unbearable pain. Throughout history, civilizations experimented with crude painkillers. Egyptians used herbs and resins, Indians used cannabis and wine, Chinese practiced acupuncture, and South Americans chewed coca leaves. Greeks and Romans turned to opium and mandrake. These methods dulled pain but were unreliable. In the 18th and 19th centuries, some surgeons even tried hypnosis, with mixed results. A real solution was still missing. The breakthrough came in the early 1800s during laughing gas parties in America, where nitrous oxide left people carefree and insensitive to pain. Dentist Horace Wells first tried it for tooth extraction, but a failed hospital demonstration ruined his reputation. His colleague, William T.G. Morton, turned to ether. On October 16, 1846, at Massachusetts General Hospital, Morton's patient underwent a tumor removal under ether and felt no pain. Surgeon John Collins Warren declared, "Gentlemen, this is no humbug." Known as Ether Day, it marked the birth of modern anesthesia. Soon after, Scottish obstetrician James Young Simpson popularized chloroform in 1847. Easier to use and more pleasant than ether, chloroform gained global fame when Queen Victoria used it during childbirth in 1853. Her approval helped erase religious objections, though chloroform carried risks of sudden cardiac death. Ether remained safer but less convenient. By the late 1800s, attention shifted to local anesthesia. In 1884, Viennese surgeon Karl Kohler introduced cocaine to numb the eye during surgery. Despite its effectiveness, addiction and overdoses led to safer alternatives like Novocaine and later lidocaine. Local and regional anesthesia allowed patients to stay awake, but pain-free during operations. As anesthesia spread, so did the need for expertise. At first, anyone, nurses, students, assistants, administered it, leading to fatal errors. By the 20th century, anesthesiology became a medical specialty, with new equipment like inhalers, masks, intubation tubes, and monitoring devices making anesthesia precise and safe. Later innovations like intravenous agents and modern gases, halothane, sevoflurane, further improved safety. The impact was revolutionary. Anesthesia made complex surgeries, brain operations, heart surgery, organ transplants, possible, transforming hospitals from places of last resort into centers of healing. It also reshaped childbirth, dentistry, emergency medicine, and pain management. From the screams of pre-anesthetic surgery to the calm silence of today's operating rooms, anesthesia remains one of medicine's greatest miracles, turning horror into healing and restoring dignity to patients worldwide.